Hey guys, welcome to the Dr. Cliff Worldwide Vet YouTube channel. I decided today on a whim, as you can see behind me here, I'm mowing the lawn in our backyard and got my shorts on and my legs are starting to get itchy, and I thought, aha, seasonal allergies, something to talk about regarding dogs and really not cats. This is mostly for dog owners. There's Thalia in the background there checking things out. She's been helping me. So seasonal allergies or atopic dermatitis or inhalant allergies. We inhale grass or pollen or whatever, and what's that one? Ragweed, and it makes our sinuses flare up and our eyes itchy and a little bit of our skin itchy, right? Dogs don't really get that. They get skin issues. So it is, even though people think it's a contact allergy, it's not. They breathe it in, it causes inflammatory changes in their body and causes itchiness. Now, seasonal allergy can happen with any sort of dog, but there's certainly a few breeds. I'll put them up right here. Let's give it a couple of seconds. I know of the white dogs, like the Westies, the West Highland Terriers are really bad. But seasonal allergies, Labradors too, can happen with any dog, any age, but typically it's like 2 or 3 years old is when it starts, and unfortunately can get worse. So what we do at our clinic is we basically stage them between severity, stage 1, stage 2, stage 3, or level ABC, let's say. And if you got stage 1, if your dog has stage 1, the signs are going to be itchy skin and generally the lower half, okay? So the chest, under the arms, the paws, those are the big one. They'll lick their feet a lot, right? It's generally just for a month or two. It's whatever that season is for those allergies, okay? Now with stage 1 seasonal allergies, pretty much you can deal with it over the counter. Now the first thing you want to do though, and you may want to talk to your veterinarian, of course, a little legal advice there, I don't want to get in trouble, talk to your veterinarian, but the big issue with allergies, whether it's stage 1, 2, or 3, are the secondary complications, things like pyodermas, so skin infections, or fungal infections. Pyoderma is bacterial, fungal infections of the feet, of the skin, and them not being able to sleep and just general comfort, right? But what we want to do, our main goal, or what we're going to be able to reasonably reach, is just avoiding those complications, okay? So look for those signs of, I'm going to put it up here, look for those signs of pyoderma and yeast dermatitis, okay? And if it's really, really bad, talk to your veterinarian. You're going to need some systemic medications, maybe an antibiotic injection, maybe some pills, maybe some antifungal prescription strength topical medication, topical cortisone, that's prescription strength. But if it's minor, and I think it's fair that you can, don't let this sort of take over advice of your veterinarian, talk to your veterinarian again. I don't want Judge Judy getting mad at me, but you can actually get some stuff over the counter. Maybe call your veterinarian. They could probably give you some stuff right then and there over the phone if they've seen your veterinarian or seen your pet regularly, but also check out the pet store. So omega fatty acids, not human omega fatty acids, get ones that are designed for dogs at your pet store or ask your veterinarian. Omega fatty acids, basically over time, they take 3 or 4 weeks to kick in. Put it in their food, a little pump. The dog will think it's gravy. It's very, very yummy apparently. Omega fatty acids help return moisture to the skin, help with the bacteria, the healthy bacteria in the skin. They do reduce itchiness. They're also good for reducing arthritis, improving heart health, reducing cancer, general immune system function. So they're really, really good. So start your dog on it. My recommendation is to actually put your dog on it. Once the allergies start to show up, do it year round. You might as well. It's got all these benefits and it's super inexpensive. Also, you can pick up an over-the-counter antifungal, antibacterial, anti-itch shampoo. Do that probably once a week in the beginning. If it's really bad, do it twice a week. You could even just sort of locally do it on the feet or wherever, under the arms, wherever it's itchy. But that's something that you should think of as well, okay? The other thing to do is see if there's like an anti-itch spray, again, over the counter. Really, really helps. So these are the things that are just, stage 1. They're just going to help your puppy, your adult dog, feel a little bit better, and until the season runs out, right? We can't really cure allergies like this. Now, stage 2 is when it starts to become longer, potentially year round, and more severe during that initial time. And it's when these over-the-counter medications aren't helping and your pet is having trouble sleeping and is starting to get these infections more regularly, that's when you need to speak to your veterinarian. And you're going to be getting things like Atopica, which is a prescription medication that helps reduce itch. There's a great sort of injectable anti-itch kind of vaccine. It's sort of complicated, called Cytopoint, that can really help. Even some really good, safe, strong cortisone sprays. Again, none of these things are curing allergies. Just like with us, we can't really cure our allergies, but we can reduce the symptoms. Now, stage 3. Very rare that your dog's going to develop stage 3, but shout out to my little puppy nephew Odin, who my sister adopted, knowing that he's a little white dog, kind of got a bit of Westie Terrier maybe in him, but knowing that he had these skin issues, she still adopted him from the US, brought him down to Canada. He became a Kanake, and woohoo! He's got really nasty allergies, and he actually, after coming and seeing me over and over again, we got him to see a veterinarian dermatologist. Yes, there are veterinarian dermatologists. They actually do an extra 2 or 3 years of school. I wanted out as soon as I was finished my primary care stuff. But they are specialists in skin, and they'll actually test your dog to find out what your dog's allergic to. Is it grass? Is it trees? Is it flowers? And specifically what kind? And then they'll actually create an injectable anti-allergy serum and they'll teach you how to give these injections, okay? So it might be once a week for 6 months, and then eventually once every 2 weeks, and then eventually once a month. But the big thing is, now it is costly. It's probably a good couple of grand a year potentially. So obviously, thank goodness, it's only rare that these animals go into the stage 3. But it's really effective. It doesn't clear it up 100%, but I used to see Odin at my clinic all the time. Now I hardly get to see him because he's so healthy and he's rarely got itchy issues. In fact, the dermatologist sees him every 3 months, and I think she sees him more than I do. But I'm happy that Odin's feeling better. So there you go. It's a beautiful day out here. I got to finish up the lawn mowing and maybe take an antihistamine. Oh, antihistamines. They don't really work in dogs. Benadryl itself makes them really sleepy. So like diphenhydramine is the chemical name. But basically human antihistamines, please don't try them because some of them have like pseudoephedrine to dry out your eyes, dry out your nose. Not safe for dogs at all. The dosaging is really tricky too. Now there are some hydroxyzines and prescription antihistamines for dogs. They probably work in about 25% of cases and only a little bit. So antihistamines, there's my segue. I'm gonna go take an antihistamine maybe, and maybe have a beer too. I think I deserve it. Thanks for watching. Check it out, comment. If you have questions, comment, subscribe, share with your friends, do all those things. Check out our Patreon page for cool merchandise like this and for some behind the scenes footage. And last but not least, be kind to animals. Thanks, guys.